Hello, Nova Science, Technology, Engineering, and Mathematics community. My name is Anna Gborie, a student at Nova College in Woodbridge. I'm currently taking the prerequisite classes for the nursing program, and Biology 142 is one of the courses. I just want to appreciate the professor for giving me the opportunity to make this presentation. The title of my presentation is Cardiovascular Disease Prevention. In this presentation, I shall outline the leading causes of cardiovascular diseases and the different stages of preventing them. I will also mention how COVID-19 impacts cardiovascular health. My sources for this research are the American College of Cardiology and the American Heart Association. As a prospective nursing student, preventive health care is a prime concern of mine and an area I intend to specialize in to improve health care nationally and globally. I believe that prevention is better than cure because it saves time and resources, and because some illnesses have no going back when they are contracted. Illnesses related to the cardiovascular system have been a topic of concern and research due to its high prevalence in the United States and globally. Cardiovascular disease remains the leading cause of morbidity and mortality in the United States as well as globally. It affects most racial and ethnic groups, with an estimated cost of over $200 billion annually in healthcare services, medications, and lost productivity. The main contributing factors are age and lifestyle, as well as socio-economic status. Age plays a crucial role in prevention of any illness. The earlier preventive measures begin and healthy lifestyles are inculcated into kids, the healthier adults we will have. Cardiovascular illnesses are higher in older people. And socioeconomic status of a person can significantly influence their health, including their air pollution exposure in the area they live in, the activities they engage in for work as well as recreation. Okay, I shall outline the three main ways of preventing cardiovascular disease. The first primary stage involves preventive measures taken to prevent the onset of a disease. Prevention strategies must include a strong focus on lifestyle optimization, such as improvements in diet, physical activity, and avoidance of tobacco use, as well as exposure to secondhand smoke to minimize the risk of cardiovascular events. The secondary steps involve an early diagnosis of an illness so that treatment can commence immediately. Examples include self-examinations and annual screenings at a doctor's office. Only when a person's risk is sufficiently high should medications that reduce cardiovascular risk be considered for optimal treatment. The tertiary level involves preventive measures focused on rehabilitating someone following a significant illness to prevent a repetition of it or to stop it from worsening. It involves education and follow-ups by physicians to ensure that patients take medications as prescribed and undergo needed therapies. Preventive healthcare involves teamwork among physicians and patients. Adherence to recommendations can be enhanced by shared decision making between clinicians and patients, with patients' engagement in selecting interventions based on individual values, preferences, and associated conditions, and comorbidities. An essential tool in cardiovascular disease prevention is the Ascvd risk estimator. It is a calculator that was designed to be used by both clinicians and patients 40 to 79 years. It is used to estimate and monitor a patient's 10-year risk factors for cardiovascular disease. It takes into consideration a person's gender, ethnicity, age, the presence or absence of diabetes and smoking, but particularly the cholesterol levels, especially the bad cholesterol level, as well as the blood pressure levels of any patient. It facilitates a discussion around a risk-lowering intervention plan that best matches patient preferences and individualized treatment goals. Here is an example of it on the side of the presentation. The role of information technology in preventive healthcare can never be overemphasized. The internet is a great tool in enabling telehealth visits between a patient and a physician whenever a patient feels any signs of cardiovascular disease, such as abnormal heart rate, chest pains, abnormal blood pressure readings, and abnormal cholesterol levels. Patients' records are easily accessible online for physicians to track any abnormal test results and proceed with immediate actions to treat a patient. The current pandemic COVID-19 has an impact on the cardiovascular health of people because the COVID-19 virus mainly targets the lungs and it can affect the heart by making it work harder to carry oxygenated blood throughout the body, increasing the risk for heart attack and rapid onset heart failure. Viral illnesses are known to destabilize plaques that can develop into blockages in the arteries, putting one at an increased risk of a heart disease. Early data suggests that those with COVID-19 and hypertension or cardiovascular disease have a mortality rate of 2 to 3 times higher than the general COVID-19 population, indicating that they are highly susceptible to more severe disease effects. The rise in self-isolation and sedentary lifestyle due to COVID-19, particularly among older persons, may also accelerate risks for cardiovascular heart problems. People are advised to remain active at home as much as possible by continuing exercises such as walking, jogging, and stretching. Here is a brief concept map that highlights all the points that I made in the previous presentation, showing the leading causes of cardiovascular disease and the preventive measures that should be taken. Genetics and family history, diseases, age, all are risk factors for cardiovascular disease. But lifestyle changes, weight management, and management of other diseases as well as health literacy will definitely help prevent cardiovascular disease. I thank you all for your attention. Goodbye.